question, why do you talk about my organs? If I have a deficiency, is something wrong with that organ? So if you look at the Chinese medicine and the way that our diagnostic system works, we do talk a lot about organs. That's because the names of our points are named after the organs. So for example, we have lines on the body, they're called the meridians, and that's just the nomenclature for the points. It's our way to remember where all the points are on the body because there's a lot. So your large intestine meridian is on your face and down your hand to this point here, which a lot of people know is like a headache point. A lot of people learned, even if they don't know anything about acupuncture, you can squeeze there for a headache. That's large intestine 4. It's the command point of the head and neck. So we use it for headache or any kind of issue that's going on with the face. We also use it for, because it's a large intestine point, digestive issues. It's one of the most commonly used points on the body. But when we talk about the organs, it doesn't necessarily mean that it is anything wrong with that actual organ. It just means there is something wrong with those acupuncture points. The things that those particular acupuncture points on that part of the body, the things that they control, something is out of whack there. Your intestine might be a-okay. For example, a great example of this is going to be somebody that has tennis elbow. So if somebody's having pain right here, this is right along the large intestine meridian. They're probably not having a whole lot. I mean, they might be, but probably not like having constipation. That might not be what they're coming in here for. So their large intestine might be a-okay. But I'm going to say that they have an issue with sorry guys, this is awkward trying to show you this, that they have an issue with their large intestine meridian because of the area that they're having pain in. So sometimes there's an overlap between what we diagnose and what we're actually seeing. One of those examples is like I have a couple of blood pressure patients who they have an issue with their kidneys, and they have an issue with their kidneys that's leading to high blood pressure and hypertension in Western medicine. But for the most part, it doesn't necessarily mean that there's anything going on with that actually.